Hello, everyone. My name is Guillermo Hamlin. I'm here with Ward 4 City Councilor Ryan O'Malley in the city of Malden, updating us on COVID-19 and also uh, Ward 4 and how it's been. Ryan O'Malley, how are you today?
I'm doing well. Thank you for having me.
How are you? And most importantly, how are you and your family? Are you secure and are you safe?
We are secure. We are safe. We've been um, getting to know each other a lot more than we did previously. Everyone's kind of trapped inside, so it's been nice to kind of catch up with family, catch up with friends via Zoom, kind of reminding us what's important in life. We're doing well though.
And in addition to that, like, how have you gotten closer?
We've been cooking together a lot more. I think that you can't go out to eat. You can't order in. I mean, I guess you can order in, but the options are a little bit less. So family meals have been great. Learning to cook new meals.
So, in addition to cooking new meals with your family, how has the city councilor portion of your life informed your quarantine? I imagine it must have, being the place where your constituents go to resolve some of their issues.
I mean, the city. What I've really found fascinating during this whole COVID-19 pandemic is, I think on the national level, we saw a lot of inaction for a much longer time than I think than should have happened. And so what you ended up seeing is community groups and various other nonprofit groups kind of fill in the void that was left by the government at that point. Um, and when it comes to the city council role, we've been making sure that we are providing the resources that our community needs um, to stay stable. I think that's what we're really focusing on, is how can we make sure during this historic time that our community is not negatively impacted by the consequences of COVID-19. It's a really changing environment. We're still learning about it, and waiting for guidance from the federal and state government is part of that. Because the last thing we want to do is to go off on a tangent and realize that what we were doing um, wasn't necessary or could actually harm the situation.
So, overall, how is Ward 4? How has this affected your constituents?
Ward 4 specifically, obviously Ward 4 is primarily Malden Center, Oak Grove, Main Street. It's like the heart and soul of Malden when people think of traditional Malden. And so it's actually been a huge impact on Ward 4 because of all the businesses that we have downtown. Um, I think that we are in a really dangerous spot. We had we had really made a lot of progress when it comes to the revitalization of Malden Center, and this has kind of thrown a wrench in the works. So we have made sure to utilize resources that we have to try our best to make sure that there are, potential grants and loans for small businesses to make sure that we can get them through this valley. In addition to the paycheck protection program that the federal government has, and we utilized money from HUD, our Community Development Block Grant (CDBG) money, in that manner.
So I'm glad to hear that from a city standpoint, you're being robust and you're being responsive. How have the businesses been? Have they been willing or able to seek help through you, or how have they weathered on their own? Are there any stories about Ward 4 businesses? I mean, Malden Center, Oak Grove, there's a lot of economic activity. There's a lot of uh, foot traffic that runs through there. How has that been now?
The primary connection I've had with businesses right now is questions about how they can safely um, allow, like particularly the essential businesses that are currently still functioning, like small grocery stores, et cetera. Their big thing is, what precautions should they be taking to make sure that their customers and their staff are safe? Um, the Board of Health is the primary contact here. I have no background in public health or epidemiology, so a lot of the connection really is to our emergency management team and the Board of Health. That has been the primary flow of contact so far. So whenever I get questions about, how can we operate in a safe manner, I do forward them on to the Board of Health and the Emergency Management Department of Malden. As a city councilor, that's always been our primary role. We aren't the subject matter experts, but we know who the subject matter experts are, and helping put people in contact with the proper department and facilitating those conversations is what I view our primary role as being.
So I love how you broke that down for me, because I know for the sake of these broadcasts, for the sake of just understanding, I always assume that the person on the other end of the tube or the screen is 5 years old, so we can really break it down. So I'm really grateful that you broke it down that way. Assuming everyone can get their services met and need, everything's running on time, how would a successful reopening look like in Multan Center, in Oak Grove, in the city of Malden overall? How do you feel a successful reopening would be? And not to really put too much pressure on you, because I'm not suggesting that you'd be able to really resolve every single issue, but so far, what would you think be a good reopening?
I'm a big proponent of the methodology and the plan that Dr. Anthony Fauci is putting forward. Actually, Dr. Fauci is a graduate of Holy Cross also.
Holy
He
Cross.
was actually also a classics major, like I was. And so I think he's been, what he says is it's better to be over cautious now, because if we're wrong about it, it's only going to be that much worse. So I'm a big believer of being very cautious and having a very slow and staggered reopening, just because the last thing we want is for there to be a huge surge like there was during 1918, the flu pandemic, that puts us back into our homes for another 6 months. So a slow, staggered start. Again, not an epidemiologist. This is not my specialty. I listen to the specialists on this. I think we're really leaning hard on the Commonwealth, Governor Baker and the Department of Public Health, to make sure that communities like Malden. I mean, we have a lot of cases, upwards of almost 1,000. We have 989 cases confirmed, which is likely very much lower than what we actually have. And we've had 68 deaths, unfortunately. So this has had a real impact on Malden. And I think a slow stagger opening would be preferable. I am the chair of public properties, and myself and Councilor Winslow, who is the chair of the Public Safety Committee, we had a joint committee recently to discuss how we can allow there to be more public space for people to travel. So one of the challenges we have in the city is we're very dense and our sidewalks aren't huge. So if you're walking down the street, it's very difficult for you to pass someone while maintaining a social distance. And often what results is people going in the street. We've had people get hit since this pandemic has started, and we want to make sure that people have space. So we're looking at ways in which, as there's less traffic on the roads because of the shutdown, how can we give people more space? This might result in, some streets having one side of the parking, kind of like in a winter parking ban, closed down so that people can walk in the street. And this is particularly important as we reopen, because as you have more people on the street, you have more potential vectors, more potential for infection. So giving people the space to walk down the street and go to the train and go to work is going to be crucial.
In addition to that cruciality, you mentioned earlier that this was a wrench in the works to a lot of the stuff that the city of Malden was planning on doing and investing in doing. Do we anticipate, such as the state itself, that there will be continued fiscal shortfalls in the city of Malden? And how do you feel as though that would affect your ability to serve your constituents?
100%. From what I'm hearing from our financial team, the state is looking at a potential $6 billion shortfall in their budget, which, when you trickle that down, I mean, this is it's definitely going to impact Malden because we do have a large amount of state aid. And if that's reduced significantly, Prop 2.5 doesn't allow us to increase taxes by more than 2.5%. So the only way we can make up on a budget shortfall for the city is through cuts. And we have, over the last 5 years or more, have cut the budget, or not cut the budget, but made the budget very lean, a very lean operating budget. So what we end up looking at, and what we end up seeing, is how can we keep people that we need to provide essential jobs in their job without bankrupting the city. That's one of the challenges that we face. There are different techniques that can be taken for that, anywhere from layoffs to furloughs, and we're hoping to have the least amount of pain. We haven't seen a budget yet, so I don't know where we're at, but I mean, as a community, we need to prepare. If you even think about it this way, restaurants have been closed, so we have a meals tax. We get money from meals tax. To a large degree, people aren't buying scratch tickets right now because they don't have a lot of disposable income. We get money from the lottery when it comes to how much money Malden residents buy or participate in the lottery. So there's a lot of impacts here that we don't fully understand yet, but it's going to be significant.
Thank you for, again, I didn't even consider that. And that's a phenomenal way to break it down. There are, shortages in revenue in addition to the increased costs that came from just servicing constituents in this time of need. What has been the most pressing need from a constituent to a city councilor during this time?
The biggest need right now, I would say, is primarily housing, which has always been. I feel like everything we deal with is a housing issue. We know the Boston area has a huge housing shortage. Malden particularly has a affordability issue. Our residents are paying top dollar for their housing, and that doesn't leave people enough cushion to afford food, to afford healthcare, to afford things that really contribute to the quality of life. So we need to figure out a way to develop a housing stock that allows our residents to live comfortably and not end up living on the streets. That's even before the COVID-19 crisis. The hardest phone calls that we get as elected officials are, I'm losing my home and I grew up here in Malden and I have nowhere to go. I'm going to be on the street. Please help me. There's no simple answer to that. So one of the things that we've tried to do, with the help of the Community Preservation Act that was passed in 2015, is to fund a rental assistance program, which we hope will keep people and tenants in their homes, and also trickle up to property owners. My preference would be to owner-occupied properties and to homes with children in the school system, to provide stability for our community. We've also funded Under One Roof, which is a program put on by the Bread of Life that will develop 14, I believe, affordable housing units at their facility on Eastern Ave next to the bike path. So I think that what we really need to focus on is how are we going to make sure that we have high quality, affordable housing so that our residents aren't homeless.
In addition to that, and thank you for bringing up housing, I serve on the board of the Community Action Agency of Somerville, so I commend you on that. Expanding on the issue of COVID-19, Cambridge Health Alliance in Malden has been supplying testing. At least that's my understanding. Could you provide us an update on what that is like, or better yet, how is that operated? For those, I understand it expands to Everett. So let's say I'm an Everett resident or a Malden resident looking to get tested. How should I proceed?
If you so Cambridge Health Alliance originally started a drive-through testing facility in their parking lot that was only for Cambridge Health Alliance customers or patients, and they expanded that. I believe they got a grant through the state in order to allow for anyone living in Malden and Everett to participate and get tested through a nasal swab. That nasal swab will tell you whether or not you have COVID-19 right now actively, which is different from the blood test, which will tell you if you have antibodies, which shows you if you've ever had COVID-19. So if you want to participate in that, you need to go to the Cambridge Health Alliance website, and there's a phone number you can call. I don't have that in front of me right now. But if you want to participate, you need to call ahead, let them know you're coming, and they'll give you a time in which to show up. You drive up, you put your head back, they swab your nose, and they bring it up for testing. I've been told it's very, very efficient, and you get the results in I think like a 5-day turnaround. And I've just only heard good things about the program. So thank you to Cambridge Health Alliance for providing a safety net for our community. I think that this is, not to throw Hallmark Health or Melrose Wakefield Hospital under the bus, but I mean, this is the benefit of having a medical facility in your community. And I'm very thankful to Cambridge Health Alliance for filling the gap that was left by the closure of the Malden Hospital site 20 years ago. Can
you break it down for me, like on 5, the closure of the Malden Hospital 20 years ago?
I wasn't. I mean, I was around physically, but I was a child.
Okay, but
so my understanding is they basically, they're trying to cut costs, and they closed down the hospital when they told us that they weren't going to be closing down the hospital, and it's been a huge issue for decades now. I'm really happy that we have Amanda Linehan in Ward 3, who's advocating for making sure that it's some type of use that is going to hopefully benefit public health in the future. So I think that's something to look for. I think we're still in the community engagement process. But yeah, Malden Hospital no longer being a medical facility has been a huge issue for Malden in terms of public health.
So in addition to the public health matter, there is the housing issue that's been prevalent in, as you've mentioned, the Community Preservation Committee. Was that what it was?
Say that one more time.
You mentioned the Community Preservation Act? Was there a committee that recently met on something regarding the housing?
Yeah, the Community Preservation Committee,
Community Preservation Committee, thank you.
They sent a recommendation to the mayor for the funding of 3 affordable housing projects. And that was recently passed and approved by the council this past Tuesday. And so that's what that reference was to.
Awesome, thank you so much. So in winding down, consuming all this stress and dealing with your constituents' various needs, whether it be from small business, nonprofit, personal, whether it be housing, as you mentioned, or public health, where can I seek out some healthcare should I have the symptoms? But personally, how have you unwinded from screen time? How have you unwinded from the phone calls in the time of quarantine and this time? Like, just how have you just relaxed, if you don't mind me asking?
Yeah, no, absolutely. Thank you for asking. Reconnecting with friends and family, as I said earlier, has been kind of really crucial. Going for bike rides, listening to audiobooks. There's a great app called Overdrive. I recommend it to everyone. Download it right now. You can connect your library card, and you can access audiobooks and ebooks for free, especially now that libraries are closed. So again, Overdrive, it's a great app. and you just check out books the same way you would through the library. So I have been listening to audiobooks. In addition, I've also been doing a lot of gardening. I built a raised bed garden, which has been great. And just recently, we had the water line in front of my house replaced. So there was a open sidewalk panel. And I actually just today buried a time capsule with like newspapers and different artifacts of stuff that kind of will hopefully allow the people of 2120 to understand a little bit more about what's happening in 2020. So that's
Wow, I love that.
small
So
things like that.
a 2020 time capsule. So that in itself is a story. Thank you so much.
Absolutely.
Counselor, so
one of
yeah,
the
go
things,
on.
one of the things to mark the spot,
Mhm.
there's a piece of stone actually from our new city hall.
Wow.
What we're making the floor with. I'm going to mark the spot in the sidewalk with that little piece of stone, so people know where to kind of open it up in 100 years.
So, so beyond the time capsule itself, what else did you? So, what made you decide what to put in that time capsule? Like, what made you decide this newspaper, this rock? Like, what made you decide the items?
My time limit. I didn't have a lot of time.
Oh, really?
We're going to be pouring the concrete, I believe, today. So I needed to figure out how to get it in the ground quickly.
Amazing.
So I did the observer advocate. I did the advocate. I did a few other things. I wrote a little letter to explain kind of what's going on. I gave some statistics in terms of COVID-19. It was mostly just I needed to get it in the ground. I got some pennies that were from 2020 because who knows, pennies probably won't exist in 100 years.
Yeah, they probably won't.
Stamps, because stamps
Amazing.
probably won't exist in 100 years.
Yeah. Well, and is that because of the recent issues that the Postal Service is dealing with in the midst of COVID-19?
I think everything. I mean, I highly doubt that physical stamps are going to exist in 100 years.
I actually believe you on that regard. I feel that cash, in addition to being perceived as a contaminant, I feel like is not really useful. I feel as though people are viewing cash as well as the coins themselves before we even get to pennies, because pennies are, in my opinion, wasteful. But the idea that
actually, the fact that the pennies are they cost more to mint than they are worth.
Yeah,
is actually fascinating. Actually, what's funny? I actually can hear some construction activity, and I think that they're pouring the concrete as we speak.
That's amazing. That's so funny. Well, I mean, that's just timing, I suppose.
Yeah.
So, in addition to everything else, what would you like to tell right now, if possible, those people in 100 years of your why you put what is the message that you want them to take from the time capsule and everything inside the time capsule?
We're at just such a interesting time in our society's maturity. Like, so many things are happening right now that have never happened before or haven't happened in a century. And so we're just going through a lot of transformational change, and documenting stuff now is really important because our generation has a unique opportunity to peer back, particularly millennials. We have the unique opportunity to peer back into the past and also be able to share that in the future. So I doubt, and I know I won't be here in 2120.
Yeah.
And so just being able to pass on some information to the future, I think is crucial. And I think we should actually do this as a city. We just recently reburied one from, I think, the 70s that was at City Hall. And so it would be nice for us to bury a new time capsule somewhere in the city to be opened, who knows how far in the future, to kind of show what life was like now.
That's great.
Crucial time.
And I agree. Like, I wish I had a time capsule from the time of the Spanish flu. I think that would have been fascinating to learn. Spanish flu was, I don't even know what the actual flu was called, but that was just the unfortunate term that they called the flu at that time. It was actually like very similar to a lot of the stuff that, Malden Together and a lot of these other people are talking about, this xenophobia attached to public health, as though we're...
And actually, now that you mention it, the City Council will be passing a resolution on Tuesday, which I helped co-write, that is basically condemning the xenophobic stuff that has been and bigotry that has been coming out recently against the Asian community in Malden and across the country. It's geared off of a 2016 resolution that we did in support of our Muslim brothers and sisters here in Malden. So now is the time for us to step up and speak up and make sure that we're taking care of our friends, families, and neighbors.
Well, certainly, and it's so fascinating in bringing that up because, myself being of Latin American origin, as well as like British and Portuguese origin, it's fascinating hearing. I just want to know what it was like in that time, in 1912, hearing the same thing, that the Spaniards brought this upon us, and that rather than addressing public health matters, they're pathologizing this hatred towards another people to blame. And I find that unfortunate that 100 years later, we're, beyond that, we're dealing with the same issues. We're dealing with the same concern.
I don't know if it's true. I haven't done the research on it 100%, but I heard, and it might not be true, so please do your own research.
Of course.
That it might have, like the flu of 1918 might have actually started in Ohio or something, or the Midwest somewhere. And, how it ends up being called the Spanish flu is, beyond me. But I think that that's something that we need to kind of be vigilant of. That's why the World Health Organization has gotten away from naming things based on, their original, the place they were first discovered. I think that sensitivity is important.
Yeah, and I so think that it just could be potentially misleading, especially for those who wish to inflame xenophobic fears, for those who are really suffering and fear as though that there is this diminishing resource to assist them, in which case that's when it's ripe for stirring fear and division. And ultimately, it's just sad because you're really obfuscating and you're really delaying pain, when it could be rather more productive to really just address the matter while bringing us all together to really resolve it quicker.
And there's plenty of examples of why avoiding these type of naming conventions is important. Like if you go back to the AIDS crisis, HIV was originally called like the gay related disease. Mm-hmm. So people thought, oh, only gay people could get this, so they didn't take precautions, and that helped exacerbate the HIV/AIDS pandemic. So it's important to name things in a scientific manner and not in a biased manner.
Yeah, I completely agree. If not just because it's just largely misinformative in a way that could probably just make people feel foolish, look foolish, and could potentially harm people. Well, so beyond that, Ryan O'Malley, I just want to thank you. Any parting words, anywhere, any place where our viewers can contact you? Please, by all means, the floor is yours.
Yeah, no, you can, so parting words, I would say, be cautious, be extra cautious. We don't know a lot about this virus. Don't assume that young people and children can't be affected. We're finding out more and more that there's a good chance that children can get affected, that adults, young, healthy adults can also be affected. So, now is the time to be very, very precautious. Even if things open up, be careful, take precautions. Don't go raging at the bars the second they open, which we've seen happen in other states. If people want to get in contact with me, you can connect with me on Facebook, Multan O'Malley. That's my official Facebook. If you'd like to connect via email, my email is r.o'malley@cityofmalden.org. So, I'm available, looking forward to any questions, concerns, and if anyone needs help, please reach out.
Well, thank you so much, Ryan O'Malley, for coming on to our Government Access program. We wish you the best, and we wish you a safe, a safe weekend. Thank you so much. Thank you
for having me, Guillermo, and I wish a happy and safe weekend to you also.
Thank you so much. Have a great day.
Bye.